So Vinod, thank you. Thank you for coming here today. I think one of the cool things for me as an observer of healthcare and erstwhile participant over the past few years is to see, in especially the last couple of years, people of great renown and caliber. Tim O'Reilly was here earlier. Of course, Andy Grove was here this morning, and now you, of course, who are now taking an interest in healthcare. I mean, perhaps it's long-standing. We can get into that, but it's exciting, I think, for those of us who are who may have a foot in the traditional world of healthcare, to see people of such entrepreneurial vision and ability to take on healthcare, because it hasn't been that way. It hasn't been recognized as an area of promise and opportunity. So I'm hoping in the half hour we have today, we can touch on a few things that you see going on in healthcare and why you think it's basically worth your while these days. Let me just offer that as the first question. I mean, it has historically been a black hole in the economy, and do you get the sense that that's changing?
So, my point of view, for those of you who don't know, I actually trained as a biomedical engineer. My master's degree was in biomedical engineering. So when I started my career, I was actually very interested in the intersection of technology and human health.
So you're coming home again.
I'm sort of coming home again. But to answer your question, there's really two very different things going on. There's a healthcare world that most healthcare investors know that I know nothing about, fortunately. And that's the world of starts with reimbursement and insurance and MDs and FDA. I look at this area from a completely different perspective, and that's consumers. That's sort of the change in technology that enables a doctor to stop being a practitioner of voodoo medicine and be an intelligent scientist. It's about economics. It's about health. It's about wellness care, not sick care. It's about being data-driven and easy access and friction-free access. It's a whole different world than healthcare. And I think if you know too much about the healthcare, you will fail to try the things that will cause innovation. Mm-hmm. And so, in fact, there was a great article. The same thing happened in payments. I'm on the board of Square. We were the Series A investor in Square. And recently, in a Wired article, Jack Dorsey was asked, everybody's been looking at payments for so long. How come you're innovating? And he said, well, we have 250 people here, and only 5 ever worked in payments before. And that token 5 is valuable, but too many of those healthcare people who know what can't be done get in the way. So that's where I come from. I also come from a world where I believe everything that's possible eventually happens. And how long it takes to get there depends on how successful incumbents are in slowing you down, getting in the way, blocking you. I start with a very positive notion that, and I first sort of really formally started thinking about it when I thought about healthcare in India. There's no FDA that matters in India. There is no MDs that matter. The vast majority of the people, my own mother didn't see her doctor other than her kid's birth till she was 60 for the very first time. They don't have access to doctors, so you don't have to worry about doctors. And I was saying, how do you get them access to wellness? And when they get sick care. And something great happened. There was this going on at the same time Google was doing the driverless car. When I looked at the technological problem of driving a car without a human being from here to LA, it's maybe 2 orders of magnitude more complex a problem that has already been solved, then then the problem of taking a bunch of symptoms from a patient and saying which one of at most 10, 15,000 diseases they have. It's a way simpler problem. Machine learning makes a much better Dr. House than Dr. House. And 99% of the doctors don't meet the standard of Dr. House. So if you say, how do we get the same level of healthcare without a doctor that the 80th percentile doctor could provide with the same symptoms, same inputs, same tests? Almost certainly it's a very simple machine learning problem relative to problems that have already been solved. A relatively simple problem. So that's what's possible. Now all these things you think about, the next little step gets in the way. FDA does.
And they're not such little things. I mean, it's the apparatus, the whole infrastructure of healthcare, which is kind of been the obstacle for many people over the years.
Only in this country. Healthcare is a global problem. So why do we limit what we attempt just because the FDA does some regulation here? You know, and there's lots of ways. So here's something about innovation. It starts at the fringe. So keep this vision of what's possible. Doctors can be replaced by software. 80% of them can. Maybe more, possibly more, probably more, but at least 80% can. I'd much rather have a good machine learning system diagnose my disease. If we have time, I'll come back to my favorite psychiatry manual, the DSM manual, where kappas or correlations of 0.2 are acceptable in diagnosing patients. But I'd much rather have a system like that objectively diagnose my disease than the median or average doctor. And everybody thinks they have better than average, but they don't. The average person gets statistically the average doctor. And so, you know, from my point of view, there's the large vision, and then you say what's happening today. First, take psychiatry. You can diagnose the mental state of a patient much better with sensors than you can with a psychiatrist. And it's simply easy to test out, and I wish we had 3 hours to talk about this. If you can do genomics, which is changing, and it's sort of becoming relatively trivial compared to one single dose. It's far cheaper to sequence the human genome completely than to get one dose of rituximab from Genentech. One dose. And you need many. You look at sensors that can actually do blood analysis. I just enrolled in a study. They'll characterize 14,000 things out of my blood sample. All the proteins, all that. You're starting to get data on which you can actually do medicine. So sensors becoming cheap, becoming pervasive, sequencing becoming cheap, big data analytics allowing you to make conclusions. We have a great company that actually, if the data is so much that you don't know what question to ask it helps you develop your questions. What question should you ask the data? All this happening and machine learning happening, boy, healthcare is going to change very, very dramatically. That makes it a pretty exciting place.
So I get the vision, and I concur largely with the vision you're offering. But I want to just poke at a couple of the problems with implementation, right?
Okay.
So clearly you're not. I mean, you know, classically technology would route around the problem and everything would be fine, but it's not always so easy with healthcare. Many people have tried. Jim Clark tried with Healthion 15 years ago. There was a whole wave of effort to bring that kind of thinking to healthcare 10, 15 years ago, and it didn't get any traction. What is different now from then?
Well, what's different now is this issue I started to talk about earlier. You can approach it from the fringe. You can go after your typical patient, but why not address the 40 million people who don't have health insurance? Now you're out of the system. You don't have to worry about reimbursement. Mm-hmm. They still have needs. If their kid gets a ear infection, you still got to figure out what's going on and as cheaply and economically as possible, solve their problem. Most people in India don't have doctors. And then there's the other extreme. There's plenty of people who'll pay $100,000 out of their own pocket if they have a critical illness. Mm-hmm. So those are fringes, but that's where most innovation starts. The innovation in computing didn't start from IBM and mainframes. It started with this personal PC that Steve Jobs was playing around with, and many of us played with. The innovation in pharmaceuticals didn't start with Pfizer. Yeah. It started with this little company called Genentech. And Bob Swanson, who started, was an associate at Kleiner Perkins at a venture firm playing around. The innovation in telecom didn't start in 1996. Every single major telecom carrier swore they would never use internet protocols or TCP/IP in the public domain. Never. So it almost always starts in the fringe mm-hmm. and then grows exponentially. So the way to solve healthcare is not to boil the ocean. You know, there's people who have this dream of boiling the ocean and solving all of healthcare head on. There's another way, which is start a seed in the fringe that grows exponentially, and exponential growth takes over and swamps. You know, Facebook swamped the planet in less than 8 years. Why can't we do that in healthcare? Start with the uninsured, start with the people with too much money so they can afford to do custom genome sequences and custom even screening for cancer drugs, and then start to grow down the curve. I think what people here are doing will lead to that. My favorite new device is this little AliveCore EKG thing. There's a whole EKG built into this thing.
Not approved by the FDA yet.
Not yet, but it doesn't matter. So you use it someplace else. Guess what? Veterinary medicine's using it without FDA approval. You get started someplace, very soon the FDA will approve it, as will people who don't care about FDA and can't afford a regular machine. And then, you know, we'll have an EKG available. And then what will happen? You'll have an EKG every day. I end up taking almost an EKG a day. And if I send that to my doctor, he'll be swamped and say, what do I do with this? Mm-hmm. You know, just if I send him my blood sugar every morning, he'll look at the receptions. If I send him my EKG, he won't know what to do. Mm-hmm. So guess what? He'll call for some software, rely on it, help the software get better, and then eventually we won't need the doctor. It's these small incremental steps. It may take 20 years to get there. But definitely healthcare will get cheaper and better. Both have to happen at the same time, and both will happen. I sort of have this sort of bias that medicine is the practice of medicine. And it's no different than the practice of witchcraft. You have a set of practices, and you do them because people before you did them. Right? And that's what the practice means. Real next generation medicine will be about scientific arrival at conclusions, understanding probabilities, understanding statistics, understanding math, and saying, based on the science, based on the probabilities, based on data analysis, based on your genome, what's going on with your body? Mm-hmm. In fact, I wouldn't be surprised if 15 years from now, everybody has a baseline systems model of every single protein and what the normal levels of expression are. And when a deviation happens, then you know something deviated or changed. All this will happen, there's no question. How long it'll take, I can't tell you, but it sure as hell is worth trying. And all of you are contributing little beads, little stepping stones, and eventually somebody will start to connect them.
Right. So I want to ask you about some of your investments, because it's intriguing to me that I mean, there's Jawbone and Cellscope and
Misfit and
Verifica, is that?
yep.
Which I had to look up the patent filing to figure out what they use, but it's a non-invasive glucose detection.
It's a radical attempt at understanding non-invasive blood glucose monitoring.
So a lot of these are hardware-based, which is interesting to me because our hardware has been a real shoal for healthcare. For decades, people have been inventing new devices that they want to kind of get into the home, and they never get traction. So, but are we at a different phase, do you think, with medical hardware?
Yeah, I think you have to stop thinking of this. This device I just showed, this EKG device, I don't know if people have seen it.
Are you an investor in the LiveCore?
We are an investor in the LiveCore, right? The fact is, this is a simple device built into a case. If I hold it long enough, my EKG will show up there. Is this hardware or software?
Well, it's both, right? I mean, it's the.
That's my point, right? To
That's
me,
where I was going, just to let you all know.
So, I think today, especially when you're looking at solutions, you can't say you're doing one or the other. You may start in one place, or it may appear you're doing X and then Y, but in fact, everything is about giving you data. Even this waveform, without processing in software, you can't reduce the noise that comes from your hand. Right? So we have to stop thinking in traditional categories and say, what's the problem we are solving? What's the best way to solve it? What's the cheapest, most accessible way to solve it?
But the economies of scale of hardware have changed too, right? I mean, it's like that device is remarkably cheaper than the piece of hardware that it's replacing.
Absolutely.
And that I assume is an advantage for the entrepreneur as well as
right. This is what's exciting. In fact, we have done a lot more startups than the ones you mentioned. So LiveCore is another investment. I have another favorite investment called Adamant. Okay, little chip, very risky, but if you take my Jawbone band and I put a little chip on it and I breathe on it, it'll characterize hundreds of gases in my breath. If I'm about to have an asthma attack, it'll detect the nitrous oxide. If I'm diabetic and I have ketones in my breath and ketosis is happening, it'll detect the ketones. If I have lung cancer, it'll detect the lung cancer. And look, all chips cost $1, right? All chips eventually cost $1. There's very few things that you can't put a system together for less than $20. It can tell you, a CT scan, big, expensive, keep GE in business machine can tell you you might have a nodule. It can't tell you what type of lung cancer you have. A little breath analyzer can tell you what type of lung cancer you have. It can, of course, tell you whether you're drunk, but my favorite application is there is a difference in your breath components based on when you're exercising, whether you're burning fat or sugars. Now, how many people wouldn't want to know that? So there's hundreds of applications. And a little thing like that completely changes the equation. You suddenly aren't having a doctor look at you and say, oh, you're looking well. Bullshit. You can't tell. Having every metabolic process in your body that has a volatile component which will always show up in your breath. Anytime, any process in your body, whether it's ketosis or an asthma attack or burning fat or lung cancer or breast cancer, has a volatile component, shows up in your body, you got real science and real data, not this old line practice of medicine.
But are consumers going to be the ones pushing that kind of science
Absolutely.
forward?
This will start from the consumer side. I do believe revolutions happen on the outside. Very few. I was recently talking to the governor of Florida, Rick Scott, who started a healthcare company, so he was in our office talking about it. And I was talking about it, and he said, how many businesses you know that want to cut their revenue in half? He said, that's why the healthcare system won't change the healthcare system. So people like this will change the healthcare system. It's as simple as that.
So You had a few years ago, you were made big investments in biofuels, and you wrote a story in Wired about it. And I'm curious if healthcare, and that has had its hits and misses, and it's been
Mostly hits, but contrary to popular belief.
all right. I'm curious if healthcare has replaced that for you, or if it's like where does it fit in your list of investment priorities?
You know, I like to play, and the best play is when you use cool science to affect large economic problems or large social problems. That's how I look at what I do. And you know, there's a public company called Keynote. This is public record. One little company, we have larger gains in one public company in biofuels than the size of our fund that invested in it. Okay? Just to give you a characteristic, despite all the mischaracterization of what's happening in biofuels. Right? And we won't go into the details there, and I expect 5 of our 8 investments in biofuels will be public or acquired like a public company. 3 are already public of 8. Where healthcare fits is just another opportunity to address a large problem with cool technology. It's about taking risks which other people won't do. Would GE want to reduce the cost of an EKG machine to $10? Do you think?
Well,
No.
yeah.
Let me tell you, no.
They're trying. They're trying to develop such devices, but
They're trying to do the PR around such activities. But they won't. If I were to, so lots of cool possibilities. That's why my interest in healthcare. It's not exclusive. I'm also interested in big data. Related to healthcare, whether you call it a healthcare or not, we have the coolest new effort also in food, reinventing food. We have a company that's done candy going head to head against Mars with a better, healthier candy. It's not healthy, but it's way healthier than Mars candy. We have a Snickers bars, M&Ms, peanut butter cups. I don't eat much candy, but if you go to the local CVS, you can find the Unreal brand. We are redoing beef. Is that healthcare or not? To me, it is. We are redoing salt. We have a salt startup that reduces the sodium content pretty substantially in salt. Is that a healthcare startup or not?
yeah. No, I mean, absolutely.
Right? So any place, cool science, great technology can be applied to change existing wisdom and address existing large problems. It's both fun to do and an economic opportunity, and so I play. We don't play in every such area, but we play most such areas where we think we can contribute something.
And do you have a I mean, you mentioned big problems and a kind of cheap technology, but do you have a specific rule of thumb that you kind of carry throughout your investing? I mean, is there a kind of signal that you look for?
No, each situation is different, but by and large, the one signal I love is when all the experts are saying nothing can be done about something.
Like they were with energy a few years.
Like they were with energy. But if the experts believe something, what it's really saying is all the conventional people are not trying it. It's not that it's not possible, but everybody in traditional business is not going to try it. So the field's wide open for mining by entrepreneurs. It's a pretty good idea. And just to tell you my great respect for experts, Professor Tetlock at Berkeley did a study, followed 250 experts across 20 years and across 28,000 unique forecasts. Average statistical accuracy was about the same as dart-throwing monkeys. These are the best experts in each area. So the one thing you can be sure of is an expert says something can't be done, he's probably wrong. And that's a pretty good attitude for entrepreneurs here to have.
So what's the difference between an expert and an investor?
there are lots of expert investors, especially in healthcare. If you look at our website, it doesn't talk. I've never, ever referred to myself as an investor in 25 years, not once. I'm in the very simple role. When we started our firm in 2004, the tagline said venture assistant. It still says the same thing. At Kleiner, when I joined, I called myself a venture assistant. Through 25 years, I never called myself an investor or a venture capitalist even. I'm not. My job is to help entrepreneurs. That's what I do. I'm not an expert. I'm the first one to admit I don't have a clue. But I think I have some feel for which the exact wordage I use is which shots on goal to take. There's a paper on innovation on our website, highly recommended, and it talks about shots on goal. I've said publicly I don't mind investing something that has a 90% chance of not working, as long as there's a 10% chance of really making a difference. I don't mind failing, but if I succeed, it better be worth succeeding. And so I'm not pretending I know what I'm investing in. I'm not. But I do say my willingness to fail is exactly what gives me the ability to succeed. Without that willingness to fail, I wouldn't attempt the things that would cause me to succeed. And that's why I'm a huge subscriber to a George Bernard Shaw quote, one of my favorites: all human progress depends on the unreasonable man. He should have said man or woman, but I'll quote him accurately. It is the essence of what entrepreneurs do. They do unreasonable things, they do long shot things, because all the reasonable people, which is 95% of the planet, are there to do the reasonable things, and that's all the incremental stuff. And the big companies do that pretty well. They succeed at it. They'll never do anything radical, so that's the field that's wide open.
Please join me in thanking Vinod Khosla.
Thank you, everybody.